Hi everyone, Mark Reinicke here. Plantar fasciitis is such a common condition that when we try to change the name to a more appropriate name, plantar heel pain, the name just wouldn't stick. And the reason for this is that so many people had already experienced plantar fasciitis or were so familiar with the condition. This includes practitioners and people who suffered with the condition that they just did not accept the new name plantar heel pain. Now there's a very important reason why this name change is necessary and why we wanted this name change to occur is because plantar fasciitis does not properly describe the condition that you get when you are diagnosed with this particular micro tear that occurs in the heel. You see, the suffix itis in the word plantar fasciitis means inflammation. So it means that an injury has just been actively injured and your body is sending a whole lot of blood to the area with a whole lot of nutrients and a whole lot of chemicals in it to try to actively heal up the area. And that is what constitutes inflammation. But there is something else that occurs when inflammation is unsuccessful or continues for a period longer than 3 months. Then we enter something called the chronic stage, where the condition is then more accurately labeled plantar fasciosis. Now when we add this new different suffix osis, it means that your area that has been injured is no longer actively trying to heal it up with inflammation. In fact, now the tissue in that area is going through a process of degeneration, wearing down, breaking down, and this particular process cannot be treated the same way that we treat plantar fasciitis or the inflammation part. So once you know and have established that it is not inflammation and that it is degeneration, then your treatment approach will be way more successful. So if you are treating something as inflammation, then you would be focusing more on resting it, you'll be focusing more on doing things like taking anti-inflammatory drugs, giving cortisone injections, because these are all modalities to knock out inflammation or to reduce inflammation. However, once you know that you have passed into this new stage of degeneration, which by far is the most common one that we see when people complain about this particular pain, then you know that employing these techniques that are based on getting rid of inflammation just will not work. I suspect this is one of the reasons why so many people suffer with plantar fasciitis, plantar fasciosis, or like we like to call it now, plantar heel pain. So once you identify that it is degenerative, it's been there for long, and you understand the process, then the treatment techniques that you use will be entirely different. The treatment techniques are oftentimes also not things that are composed of just one treatment, but you will need to have multiple treatments all at the same time to be most effective according to most research. So employing one technique, like just massaging the foot, employing one technique, like just stretching out the foot, employing one technique, like just resting and giving up your sport, is very likely not to work. And so you are more likely to suffer with this condition for a whole period of 9 months to a year, as opposed to knocking it out within a couple of weeks to 3 months. But one thing for sure, there is no quick fix for plantar heel pain. So if you do have plantar heel pain, the trick here is to just get it sorted out as quick as possible and to make sure you are seen by a practitioner who understands the intricacies of the condition and knows how to use the correct modalities, the correct treatments for this particular condition. We'll see you in the next video. Thank you.